Good afternoon, everyone. Welcome to our Facebook Live today. Thank you for joining us. We hope that you are safe wherever you are during this COVID-19 pandemic. If you have been following our previous live talk, these are the topics that we have covered, which includes: does all knee pain require surgery, and knee osteoarthritis. As Dr. Chee mentioned earlier, if you are in the stage 4 of knee osteoarthritis and the pain started to affect your normal daily activities, you may consider a surgery, which will bring us to today's topic, total knee replacement. I'm Michelle, a physiotherapist at Assunta Hospital, and I'll be the moderator for today's session. It's my pleasure to have Dr. Chee Eng Keong with me today. He is a consultant orthopedic surgeon on board in Assunta Hospital. He obtained his medical doctor MD degree from University Kebangsaan Malaysia, UKM, in 1998. He then pursued his master's in orthopedic surgery training from University Malaya Medical Center, UMMC. In 2009, he joined the arthroplasty program by the Malaysia Ministry of Health and specialized in management of knee and hip joint disease and total knee and hip joint replacement. He also studied the minimally invasive and computer navigation of total knee replacement in unicompartmental knee replacement, where he did his fellowship at Prince Charles Hospital, Brisbane, Australia, and Samsung Medical Center, Seoul, Korea. Dr. Chee Eng Keong is an orthopedic surgeon since 2007 and has a wide experience in managing general orthopedic work, which includes trauma surgery in adult and pediatric, hand surgery, diabetic foot management, as well as spinal surgery. Before I hand over the next part of the session to Dr. Chee, if you have any questions during the talk, feel free to drop your questions into the comment box below. I'll bring up the questions during the Q&A section and they will be answered by our speaker later on. And also don't forget to hit the like button and share our live video with your friends and family so they can also join us in this live session. Now let us welcome our speaker today, Dr. Chee Eng Keong, on the topic total knee replacement. Please.
Thank you, Michelle, and welcome. Good afternoon. Today is actually come to our third session of our knee pain in the elderly, with the topic of total knee replacement. Okay, I will start my talk now. What is total knee replacement, or in short form we call it TKR? Actually, total knee is a surgery that replaces the worn-out cartilage of your knee. If you have a knee osteoarthritis and if reached the end stage or stage 4, you might need to consider this option if you feel other option of treatment. And as we know, total knee replacement are among the most cost-effective intervention available in treating knee osteoarthritis. So how common is this procedure done? In a perspective, as for Korean, I compare Korean with Malaysian. Korean we have 47 million of population. There's more than 60,000 knee replacement are carried out in each year. As for our population of around half of the Korean, is around 7,000 knee replacement are carried out each year in our country. But if you compare the amount, is actually we are much lower than the other country. It's because a lot of patients are not, they don't know this procedure much, they don't understand it, and then a lot of misunderstanding about this. So what are the benefits of this procedure, TKR? Because majority of the patient with knee arthritis, they experience pain. So when you have this procedure, actually the main purpose is to reduce the pain. So basically you have much less pain. And because of the pain, you have a lot of stiffness and affect the range of motion. So this procedure also is will benefit in terms of to getting better range of motion of the joint. With better motion and less pain, actually, it can be more mobile and you can travel, you can walk more easily. And this will cause your lifestyle more independence, and you no need to rely on a lot of gadgets, sticks, and a lot of help from the family. And this will indirectly also improve our lifestyle. So totally, there's a variety. You will come across a lot of variety. People will talk about this robotics. Sometimes people will say it's computer navigated. So basically, it can be classified as one is conventional, two is computer aided, which is to be more specific, can be a partial computer aided or a full computer aided. Patient specific implant, and the more recent one is more of a robotic total knee replacement. So conventional knee replacement, actually, this is an X-ray of a patient done knee replacement. Normally consists of three components. The femur, the white color one, is a metal component that we put on the bone of the knee, and then the tibia, and in between there's a plastic. So how about computer navigation? Computer navigation is a way that we do the surgery with the help of computer. It's just like you go for the tire shop, sometimes you need to do the alignment of your tire. So we use those computer to guide us to cut the bone of the knee during the surgery. That is the purpose, is to get a better alignment, hence that transport into the better outcome. So with this, actually, they do evolve into a patient-specific also. Patient-specific implant is basically, we need to do a CT scan or MRI of the patient before the surgery, and those data we input and send to a computer, and then the computer will produce a cutting block for us to cut the bone. All those things is try to improve the cutting of the bone and the precision of the surgery. And more recently is actually, we know urology, they have a robotic surgery, and in knee replacement also, with the help of this robotic arm and the computer, actually this arm is actually to guide us to cut the bone in a more precise manner. So these are the varieties. Sometimes in the market you will come across. But of course, with all those things, actually also with added costs. Like conventional surgery probably is take a shorter time with a lower cost. But if you go for the robotic, then it will cost, the price will be even double up. So normally, in total knee, we know there's a three components. Basically, there's a three component of the implant that we put into your knee. One component is over the femur, which is the bone above the joint. The other component is over the tibia. And then in between, there's a component, we call it polyethylene. Okay, so this is the X-ray view, and then this is the implant of what we can see. Basically, it's actually like we go for dental crowning. So we crown the metal over the surface of the bone up and bone down there. In between, because the two metal, you cannot grind each other. So in between, there's a plastic, or we call it polyethylene sandwich in between these two bones. So the other pictures, normally we need to cut the bone in a certain shape. We need to make holes to the bone. Then this metal actually will be capped or crowned onto the surface of the bone with the help of the cement. Most of the time we use cement, but there's other type that doesn't use cement as well. We call it cementless. But in our part of the country, normally most of the common one is still a cemented total knee replacement. On the other side, there's a metal that put over the tibia or the bone below that. and the plastic will go along with the metal below. So this is a one component. In some patients, sometimes we might need to put a fourth component, which is a patella or kneecap component. So this patella component is always a plastic component. But in this part of the world, actually it's less performed because our Asian population, the patella are smaller. So if you do this, actually the tendency of fracturing the patella, the incidence are higher. So what are the material? The most common material we use for the implant is, we call it cobalt chrome. Cobalt chrome is an alloy, it's type of alloy. It's not a stainless steel. A lot of people thought it's a stainless steel, but it looks like a stainless steel. Actually it's a shiny material, but it's actually cobalt chrome. Some material or some company do come up with a titanium, but this is more common for the cementless implant, which you don't need to put a cement on it. And there's one type we call zirconium. Zirconium is actually a kind of a ceramics, ceramic. But commonest, 90% is still made by cobalt chromium. For the component below or tibia, same, majority made by cobalt chromium. Only a small percentage is people use a titanium. And in between the two metal actually is we call it plastic. Plastic actually is made of ultra high molecular weight polyethylene PE. You see the bottle of the mineral water is actually PE. So this is a kind of dense PE with high molecular weight. So before you go for the total knee, always there's a lot of preparation you need to make for yourself. First thing, if you have hypertension, diabetes, or any medical problem, you need to stabilize. You need to stabilize your pre-existing medical condition before you go for the surgery, because this is a type of elective surgery. Dental and cardiac assessments is important. If you have a caries, you have a rotten tooth, you need to see your dentist to clear up, because rotten tooth and all those things sometimes predispose to higher risk of infection. Cardiac risk is, of course, we assess because we want to see whether your heart can take it for the operation or not. So, and most importantly, you yourself have to be mentally prepared. You need to be prepared to go for the operation. Okay, so we talk about a little bit about the cost. Actually, a lot of people worried about the cost. In a hospital, government hospital, if you are a government servant, sometimes the cost is actually negligible. Or some patient, they might want you to pay for the implant. The implant is always cost around 7,000 to 8,000 per knee. In private hospital, besides the implant, if the hospital and the surgical cost is actually range from 18,000 to 40,000 per knee. So normally, how long you need to stay in the hospital for this surgery? In overseas, sometimes with the patient which is healthy, less medical problem, they can even done as a day care. These are now becoming more popular in the States and Europe. But for our local setting, normally the hospital stay is around 3 to 7 days. That is for a single knee. That means you do one knee at a time, or sometimes you do for the total bilateral. That means both knee you do at the same setting. So actually, the hospital stay doesn't change much with how many knees you do, either one side or two sides. So the surgery actually lasts around 1 to 2 hours per knee. So if one knee is normally 1 hour, 1.5 hours, and if you do two knees concurrently, it will be around 3 hours. So anesthesia. Another question is how can it be done? Actually, both anesthesia, actually we call it regional or general anesthesia, can be done. So Regional means like the upper body you still can feel you are awake. It's in a term of spinal or epidural, or sometimes it's a combination with a nerve block. General is you sleep totally. You don't know what's happening. Once a surgery finish, only they wake you up. This is a general anesthesia. Both also can be done. But this one is actually subject to the discussion of the patient with the anesthesia, and anesthetists also need to assess your underlying condition, and then they will suggest to you which type of anesthesia is more suitable. But both type of anesthesia will give equally good outcome. Okay, how about recovery? After you do the surgery, a lot of questions come, and when can I walk, and then when can I drive? For you to walk normally after the surgery, the next day normally you can come out from the bed and do some light walking. But with normally with the help of the crutches or some support. And normally physiotherapists will guide you on this aspect. And normally you need to off the stitches or the stapler after 2 weeks. If everything done, you need to continue your physio. Most of people will gain their strength at 1 month, and you can start to do driving at 6 weeks. And a lot of time, the whole recovery will range from 3 to 6 months. That also depends on pre-morbid, how strong is your muscles, and the age of the patient. Normally, younger age of the patient, they recover faster. And before that, if your disease is not too long, your muscle is still strong, actually you will recover faster also. That's why normally we encourage people, once you have this problem, don't wait too long, because too long actually you will have other problem with the recovery because muscles are weaker. So basically the question is joint replacement a successful surgery? The answer is yes. Actually, the surgery normally gives you more of a pain relief up to 95%, and but it all depends on the good patient selection, good surgical care, and then good implant choice. Okay, what are the drawbacks? If you do the surgery, actually after that, your knee might not be the same as what you had previously. So these are artificial knee. So you need to take care to protect the joint or to protect the implant. And you need a regular follow-up to make sure everything is in place. And because of the surgery, all surgery carry risk. The risk is around 1 to 2%. So the drawback is sometimes you might encounter some surgical complications. If there's a surgical complications and it's very bad, then you might need a revision surgery. So what are the activity that you can do and cannot? So normally, by this chart, you can see expected activity after surgery. Walking, recreational walking there's no restriction. Swimming, golfing, driving, light hiking, these are all allowed. Ballroom dancing, normal stairs climbing, these are all allowed. What we don't want you to do is more of like high impact activity. Examples are like here, jogging or running. Okay, contact sports, jumping sports, and high impact aerobics. These are actually because the high impact will actually lead to more easily loosening, because the implant that is stick with the cement, if with high activity over time, it will loose. So what can go wrong with the surgery? Of course, the complication rate is around 1 to 2%. The most fear complication is still an infection. Infection is actually what can go wrong is the bacteria go inside the knee joint. If you have normal infection, it's still more easy to manage. But if you have infection over the implant, because there's an implant inside, implant is a foreign body, so the infection is more difficult to eradicate. a lot of time you might need a few surgery, long-term antibiotics, long-term hospital stays to control this problem. And even infection, you still have around 90% chance of eradications of the infections. Other complications like deep vein thrombosis. Deep vein thrombosis is actually blood clot in your calf. This is like you sit on the airplane too long, you don't move, actually the blood clot develop, and this blood clot actually pose some danger because it can travel to the lung and cause the other problem is we call it pulmonary embolisms. And like any other surgery, any general complications that arise, it can related to the anesthetic complication. So how long it will last? A lot of time, this is the question that you ask a salesman, customer, how long my car can last once I buy the car. In general, these are all statistical figure. We know after 10 years, let's say you do the knee after 10 years, if you do 100%, actually after 10 years, 95% or 95% of the patient will still have the implant intact. 5% of the patient, of course, they will encounter some problem, then they might need to do something to remove the implant. So basically, how long it will last is basically you have 95% of the implant to last for 10 years. If you drag until 20 years, it's actually 80%. That means more people will have problem, and at 30 years, it increased to 70%. That means 30% of the patients, they have problem, then they might need to revise or do something on the implant. So that's all. Thank you. I welcome questions. I'm more happy to answer the question you posed regarding the total knee.
Thank you, Dr. Chee, for the eye-opening and informative talk on total knee replacement. Now we know what to expect before and after the total knee replacement surgery and about the recovery and rehabilitation process. So please consult your orthopedic surgeon for further queries. Okay, now let's start the Q&A section, Dr. Shall we?
Yeah.
Okay, so the first question is from Liz Pauline. She was asking about what are the side effects after the surgery? How bad must a knee before we consider a TKR?
Okay, the side effect or the complication that can arise, like I mentioned before, it can be a infection at the rate of 1%. Others side effect is like deep vein thrombosis, pulmonary embolisms. These are the things sometimes, like any other surgery, that things can happen. It's not necessarily happen, but there's a percentage. That's why we call it this. What are the risks? How bad must be a knee before we can consider? It's actually based on few criteria. If you have the pain constantly and you feel most of the treatment, conservative treatment, like medicine, physiotherapy, injection, and the X-ray, when you do an X-ray, the X-ray also shows severe knee osteoarthritis at the stage 4, or we call it bone on bone. And this pain is already affecting your daily activity, your normal daily activity, then you should consider doing your knee, or you should consider a total knee replacement already.
Thank you, doctor. The next question is from Miss Rachel. She was asking, 保险有 cover 吗？
保险 or insurance
cover
其实 insurance 是有 cover 的。Insurance, that means if you are buying insurance, normally most of the insurance cover up to 70 years old. So if the insurance doesn't exclude your knee, then 它是有保的，就是说 insurance 通常是有保。
Thank you, Dr. Chee. Next question is from Miss Andrea. She was asking, is there any complications after a total knee replacement?
Complications actually, surgical complication, like I mentioned before. After that, actually, your knee, after the knee, you might not feel as natural as your own knee. That is one feeling sometimes you have. So that's why a lot of time you see we quoting the satisfaction is around 90 to 95%. You will have a scar over your front of the knee that might cause some discomfort, but the pain is not as severe as what you have previously as your osteoarthritis. So normally those discomfort is actually quite negligible. And the second thing is actually a lot of activities you need to look into. You are not allowed to do high impact activities like running, jumpings. Those are sometimes the difficulty you need to adjust.
Thank you, Dr. Chee. Next question is from Miss Pauline. She was asking, what are the activities to prevent after a TKR surgery or after full recovery?
Yeah, normally we advise patients not to squat. Actually, when you do the surgery, you can squat, but it's when necessary. We don't encourage you to do like habitual squatting, always squat, because squatting put a lot of force on the implant, and then that will lead to earlier loosening. So, like squatting, actually, we do encourage to do less squatting, and sporting activity like running and jumping are not encouraged as well.
Thank you, Dr. Chee. Next question is from Mr. Kevin. He was asking, can I do swimming and running after my surgery?
Swimming, yes, you can do swimming, no restriction, but not for running. Not for running. So normally we don't encourage running because that will put too much force on the implant.
Okay, thank you, Dr. Chee. Next question is from Mr. Sharvin. He's a football player, and after his surgery, he was asking how long is his recovery period for him to get back into football games.
Okay, normally this operation is done on the older age of patients when they have a knee OA. So normally football is not encouraged at all after this surgery. But I presume your problem might not be OA, because if you still play football, probably you have some ligament injury, which is, if ligament injury, you don't need a knee replacement. You might need to assess it, and then maybe you might need a ligament repair. So, but if regarding to the total knee, normally most of the patients can go back to their light walking and all those things after 2 to 3 months.
Thank you, Dr. Chee. Next question. Okay. So, allow me to digress a little, as I would like to take this opportunity to let you know that Assunta Hospital is offering total knee replacement packages for either one or both knees. Kindly refer to the poster, or you are more than welcome to contact our marketing department for further information. In the interest of time, I'm afraid I won't be able to address any more questions. Thank you for keeping the questions coming, and we will answer the rest of the questions by replying to your comments. Thank you once again to our speaker, Dr. Chee, for the talk, and thank you all for staying here with us throughout the session. And I hope you have benefited from this talk as much as I do.
Thank you.
Thank you.